Hello, this is Dr. Gay from First Look MRI, and this is a patient who is a pitcher. They're 16 years old, they had an injury 1 month ago, and they still have pain of their left elbow joint. And we suspect that they have an injury of their ulnar collateral ligament. Now, typically when I see the UCL injuries, they're right at the distal attachment of the sublime tubercle, but this one is a great case because it shows the anterior versus posterior bands of that medial ulnar collateral ligament, and the tear is at the proximal attachment rather than distal. So here we go. This is the medial side, and the ulnar collateral ligament has a posterior band that is back here. It comes off this horizontal part of the medial epicondyle, and it comes down here and attaches to this, which is the sublime tubercle. Let me zoom that up here. So here's the sublime tubercle, this pointy part. This is where I see it torn most often. Sometimes it's just undercut slightly, but here it's nice thick attachment right to that periosteum bone there. But here is that gap. We can see this fluid-filled gap, and again this comes up and it gets broad and attaches in a broad undersurface attachment of the medial epicondyle. Now if we go forward, if I can get the forward direction right, no, that's backwards. When it comes forwards, so again this is the posterior band. Forwards, we start to see the anterior band, and then right here we see the anterior band coming vertically. I'll zoom that back a little bit. So there it is. The anterior band is intact, coming down to the sublime tubercle. The posterior band is torn. There's a little fluid-filled gap and retraction of that. And so there we go. The difference between the anterior and posterior bands and the sublime tubercle, these three areas to think about in the UCL. And then the outside, the lateral, ulnar collateral and radial collateral ligaments over here. This whole area is nice and dark and uniform, so that is good over there. So thank you very much.